الله أكبر الله أكبر.
Good evening. I am Dr. Akl. I am a physician in Flint treating cancer patients. Today we will talk about how radiation therapy used to treat different cancers. I will focus on breast and prostate cancer. If we have time to complete both, will be fine. Otherwise, next time you will see the completion. Basically, patient with breast cancer, when a decision to give radiation therapy, those patients usually presented with a lump in the breast. Either patient felt it or mammography detected it. Then patient underwent biopsy. It came back as cancer. At this point, the decision will be made to make sure what option patient like. Either patient go for mastectomy, meaning removal of the breast, or lumpectomy. Patient keep her breast and only the cancer is removed. In those circumstances, those patients require radiation treatment. Lumpectomy and the radiation same as removing the breast. Majority of patients now do not like their breast to be taken away, so they go for lumpectomy and radiation. The cure is not compromised. Your chance of cure is the same whether you go for mastectomy or lumpectomy and radiation. Of course, not every patient is qualified for lumpectomy and radiation. Some patients say, I don't want to keep my breast, just take it away. That's fine, that's a good option. Some patients have too small breasts, and when you do the lumpectomy, the remaining portion of the breast cosmetically does not look right. So those patients better treated with mastectomy or removal of the breast. Those patients with very advanced connective tissue disorder, and when they get radiation, they get little bit of no scarring and is not good cosmetic results. Those patients also good candidate for surgery. Also, if the tumor is large, more than 5 centimeters, those patients are good for mastectomy. Why is that? Because if the tumor is 5 centimeters and the surgeon need to clear it with a couple of centimeters, that means 7 centimeters at least will be taken off the breast. So the majority of the breast will be taken out anyhow, so you might as well remove the breast completely. Not necessarily the 5 centimeters, like for those patients with very large breast, if you remove 7 centimeters or 8 centimeters, sometimes still they could keep their breast and they could get post-operative radiation therapy. So those are some indication for lumpectomy and radiation. Those patients usually have the same chance of cure as if their breast completely removed. So those patients who undergo lumpectomy and radiation therapy, they have the same chance of cure and survival, same as those patients had mastectomy. Someone will tell me, what about if the patient have positive lymph node in the axilla? Yes, that still you could, those still could be treated with the same rule, lumpectomy and radiation. So positive lymph node in the axilla is not an indication to do mastectomy. Many primary physicians confuse this point. I receive a lot of calls from primary care physicians about this point, so I wanted them to know positive axillary node is not an indication of mastectomy. Also, you need to understand that some patients, when they talk to their physician, they like to have mastectomy. That's fine also. So is not gray, is not black and white rule. There is need to be understanding between the surgeon and the patient, what option the patient like. Those patients like to have mastectomy, that's a good option. Those patients like to have lumpectomy and post-operative radiation to keep their breast, that's good option. And nowadays, what I have been seeing is the majority of patients like to keep their breasts, so they prefer to have lumpectomy and post-operative radiation, especially if they know that their chance of cure is not compromised. So what patients with breast cancer who will undergo radiation treatment need to understand? They need to understand radiation causes two side effects. Side effects during the course of treatment and side effects 6 months to many years later. The good news, those are minor and the resolving side effects. Those occur during the treatment. And if the patient is careful, they usually have minimum, if any, side effects. What does that mean? Meaning that the patient should keep their skin dry and clean. They should not expose the irradiated breast to sun. They should not rub it. They should not use hot water or very cold water or soap on it and rub on it. If they avoid those, then radiation going to be piece of cake. Going to be very simple and no big deal. Also, I recommend for those patients, they ask me, should we wear bra or not? It depends on if the patient has small breast with no rubbing against the chest wall, they don't need bra. However, for those patients who have larger breast and when they walk and the breast rub against the chest wall, this rubbing causes irritation to the breast. So I recommend for those patients to wear soft bra, preferably from cotton material to absorb if they sweat or avoid any type of irritation. Then that would be advised, because it would limit the movement of the breast and there would be no rubbing against the chest wall, and that will keep the breast with less side effects. Also, if the patient takes shower, I recommend not to use hot water and not to use the jet of the water against the skin of the breast, irradiated one, because that irritates. What I ask the patients, just to whatever maneuver they like, just to avoid hot water, soap and the jet of the shower to hit the breast. If the patient follow those, then the side effects almost very minimum, if any. Also, I advise patients do not use commercial creams. Why is that? Because commercial cream, many of them has metals, and this metal will increase the skin dose, so they will actually get more side effect to the breast. So again, no hot water, no very cold water, keep it dry as much as you can, no sun, no rubbing, no soap, no commercial cream, as much as you could. And then wear bra if you find that your breast is rubbing against the chest wall. If you follow this, then your treatment gonna be very simple and no side effects. And I tell my patients, this treatment going to be piece of cake, and they laugh. And it is true, going to be simple and no problem. So once patients start treatment, side effects usually does not occur from day one. Usually a week to 2 weeks. What happened? The breast might be slightly erythematous, slightly pinkish, very